Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I'm a cardiologist from Houston, Texas. I'm going to take the ChatGPT on a test drive to find out whether stent or medical treatment is better for patients with coronary artery disease, be it single vessel disease, multi-vessel disease, patients with diabetes, patients with heart failure, or reduced ejection fraction. So I'm going to ask a series of questions and see how well it gives you information or expand your knowledge. This is not only useful for patients, it is also useful for doctors who are doing research and for medical students and for fellows to get more accurate information about other sources of the most recently published articles. So that's one of the highlights of this presentation, which I'm going to be emphasizing. So let us begin with the basic question. First of all, stent or medical treatment for coronary artery disease. And of course, it talks about that, a stent is a metal mesh which is inserted in a blocked artery, whereas bypass surgery involves doing bypass surgeries, and medical treatment involves lifestyle modifications, weight reduction, diet, exercise, smoking cessation, and the rest of the stuff which we all know. Then I said, do stents prevent heart attack? This is a very important question, and it came up with some very interesting answers. It says stents can in fact prevent heart attack, and it is going to give us some references here. So for example, it says stents are not foolproof method of preventing heart attacks, while it can reduce heart attack and major cardiovascular events. Then I asked, can you suggest some references that show stents can prevent heart attacks? So it came up with these references, 1, 2, 3. These are all very recent references, 2016. We can pull up these references through Google search or through ChatGPT and look at their summary and pull out their charts to analyze how well it fits into what I am trying to find out. For example, this Bavishi, published in 2016, looked at a stent versus medical therapy for stable angina. And they did a meta-analysis of multiple studies, and they found that stent placement was associated with lower risk of major adverse cardiovascular events compared to medical treatment alone. So this one study, which is combining the studies of multiple sites and coming up with a composite analysis saying that stents do improve the quality of life, reduce chest pains, and in fact they have lower adverse effects compared to medical treatment. And here's another study which looks at the main concept I'm trying to get is not going to the details of each article, but telling you how you can do your medical research if you're a fellow or a resident writing up a presentation. And then you can use this information and pull up their charts and graphs to substantiate your description. So there are 3 of them. It is important. All right, so the next question I asked was, can stents prolong life? Sorry, there's a typo there, but it does forgive you for all your typos. That's another interesting. Can stents prolong life? And here it clearly says, even though stents can improve symptoms, it can reduce heart attacks, but the clear decision as whether stents can prolong life it has not been established well. So there are some studies which show there may be prolongation of life, but for the majority of the studies, like here it talks about the Courage study, which was looking at the clinical outcomes utilizing revascularization and aggressive stent drug evaluation. And here's another study, orbital study. These are all very important studies, and this is from a medical research point of view. I know for a public it may be too in-depth information, but for somebody who is preparing a presentation or for example writing a thesis, then this is going to be quite useful because it has real references to like syntax, which is a very famous article quoted by many cardiologists. So we have all these things. Now my next question was, are stents better in patients with multi-vessel disease versus bypass surgery. So I'm trying to pin down more and more accurate information, seeking questions. So then it says, for multivessel disease, it says it depends on several different factors. Generally, bypass surgery has been considered gold standard and all And here it quotes Excel study, which is looking at, and they found stent placement with newer generation drug-eluting stents was not inferior to bypass surgery in patients with multivessel disease over a 5-year follow-up. So there's another study here. So these are important studies which will give us a direction as where to look for the most pertinent information, most current pertinent information, so that we can make our presentations or write our papers. Stent or bypass surgery in patients with reduced ejection fraction. These are patients with heart failure who have significant myocardial dysfunction and dilated hearts. And in these patients, it says that, of course, surgery is a better choice for patients with multiple problems. And here it quotes a study so I'm morely, for a research point of view, looking at articles that are specifically tailored to my specific questions and concerns. And that's where I find is the freedom trial. So I can go back to Google or ChatGPT and say, pull up this freedom trial reference, then we can see what it shows. So this is how we can get in-depth answers, but not all of them are going to be reliable. But this is a good beginning for us who want to do some research from a medical research point of view. So let me pull up can you show me the article? Okay, I think something happened here. I guess the system is overloaded or something. All right, where's my prompt? Oh, we are experiencing heavy demand and high traffic volume. Okay, that's fine. Let's go back here and see if we can make another attempt. Show me freedom trial. Sorry, there's a typo there. See if it can find it. So when I ask for a freedom trial, sorry, there's a typo. It's giving me the actual reference. And this is a reference which I can pull up from New England Journal of Medicine and look at the summaries, their charts, and incorporate that into my presentation or my thesis. See, it's even giving me the summary of this article, which is very nice. So there's a lot of useful purpose in using ChatGPT to at least start scanning your research. And I hope this has given you some insight as to how this can be used for either patient education or for medical student and fellows and researchers to use ChatGPT to get the more accurate, latest information pertaining to a specific question. Thank you so much for watching this presentation. I have many other presentations on healthcare applications of ChatGPT and other artificial intelligences. Please do watch them and please do subscribe to our YouTube channel. I will see you in the next presentation.